Thank you for the opportunity to present our data. I'm Diana Otoya, a PGY2 general surgery resident at Virginia Commonwealth University, here to discuss gender trends of authors presenting at a regional vascular surgery meeting. We have nothing to disclose. In the past 50 years, the number of women in medical school has greatly increased to where now women make 50.5% of medical students. However, this increase has not been parallel in vascular surgery, as the number of certified female vascular surgeons has only grown from 9.6% to 13.1%. In 2013, 38% of integrated vascular residents were female, compared to 25% of vascular fellows. Since the start of integrated residency program in vascular surgery, the specialty has seen a dramatic rise in female trainees. An analysis by Shin et al. Noted a 167% increase in female vascular trainees from 2007 to 2017, the fastest rate compared to any other surgical subspecialty. However, work by Harris and coworkers found medical students often cite lifestyle, family, and mentorship as crucial factors influencing their career decisions. Their research noted that lack of mentors was a common concern for 29% of women. In a survey study by Kwong et al., women cited mentorship more frequently as the reason for choosing academic practice. While mentorship is important because it leads to career and personal development, improves job satisfaction, retention, and productivity, there have been multiple studies by Harris et al., Shortell et al., and Caligaro et al. That have noted the lack of female mentorship in the field of vascular surgery. We speculate that limited access to mentors who potentially would advocate for sponsorship or connect members to potential sponsors contributes to the gender gap seen within vascular surgery. Most recent data by the AAMC shows an increase in the number of female division chiefs to 29%, but overall, women still only hold 18% of key leadership positions. Regional meetings offer opportunities for mentees to interface with more influential sponsors. Such associations could potentially close gender gaps found in the field by encouraging the adoption of sponsorship and endorsement of more female vascular surgeons into highly visible leadership positions. More female leaders would increase potential mentors for the next generation of trainees. The Southern Association of Vascular Surgery was established in 1976. Its stated mission is to promote the art and science of vascular surgery and further education. The Southern is comprised of over 500 members from 15 Southern states, and the organization holds an annual symposium where selected abstracts are presented and discussed. We set forth to analyze gender as it pertains to authorship, membership, and assigned discussants at the Southern Association for Vascular Surgery's annual meeting. Additionally, we examine membership in the Southern as it compares to vascular surgery diplomats of the American Board of Surgery. We analyzed published programs from the SAVS annual meeting for the years of 2012 to 2019. Each program was analyzed for gender of member, presenter, discussant, and moderators, presentation type and topic, manuscript acceptance, and time to publication if it occurred. We analyzed the postgraduate program as well as overall SAVS membership rules. The American Board of Surgery was petitioned for diplomat gender and year of board certification for the 15 Southern states. The Society of Vascular Surgery website listing was searched for all active members who reside in those 15 Southern states. The Southern's Executive Committee was petitioned, and 2019 society membership demographics were examined. Gender assignment was made for 100% of physicians based on assigned selection from public websites such as Healthgrades, US News, Doximity, World Report, the Society of Vascular Surgery website listing, as well as faculty profile at training program websites. There were a total of 260 presentations. 26% had female presenters. Females were podium presenters 59.7% of the time compared to 75% of the time for males. Females were less likely to be published when compared to their male counterparts of 41.8% compared to 58%. Male and female presenters had approximately the same number of authors per abstract and on average similar time to manuscript publication. This graph demonstrates the most common topics at the Southern. Aortic aneurysm was the most common topic, with males more likely than females to present at 81% compared to 18%. There was no difference in gender when further differentiated between thoracic and abdominal aortic aneurysms. The topics of transplant and radiation safety had 100% female presenters and no male presenters. Females were also more likely to present on basic science topics compared to males. There was no statistical difference in gender of presenter for the remaining topics. This is a graph of the Southern's presenters. Blue are male gender presenters and red are female presenters. An analysis of covariance was used to analyze the overall trend line seen. As shown, male presenters statistically decreased over the time period examined compared to an increase in female presenters, which was statistically significant. Female and male moderators showed a similar increase from 2012 to 2019. This graph demonstrates gender for the postgraduate course presenters, again male in blue and female in red. Overall, the postgraduate course showed an increased trend in female presenters with a decrease in male presenters that was not statistically significant. This is a graph comparing the percentage of female boarded vascular surgeons for the region in yellow and membership trends for the SAVS in purple. We discovered newly boarded female vascular surgeons saw a more significant rise in female members when compared to the rise of the female SAVS members. This graph compares members of the Society of Vascular Surgery on the left and members of the Southern on the right. There is a total of 212 members that belong to both organizations. There were 412 male and 52 female SVS members from the Southern states that are not members of the SAVS. Adding these additional female SVS members to the Southern membership rolls will result in a 288% increase in overall female membership. Data received from the Southern Executive Board shown here demonstrates an increase in female membership for 2019, with the majority of applicants being younger than 40 years old. Limitations of our study include a small sample size of just one regional vascular meeting, as well as a limited analysis of abstracts presented and not those submitted. Lastly, the study does not examine race, ethnicity, sexual orientation, or gender identity. In conclusion, the proportion of female members, discussants, moderators, and authors has steadily increased at the Southern Association's vascular meeting. Female members were statistically less represented in the SAVS membership rolls compared to known boarded female vascular surgeons. Female presenters interface with female discussants only a minority of the time compared to male presenters. This demonstrates a unique opportunity for female mentorship in the field of vascular surgery. Thank you again to the Southern Association of Vascular Surgery and the Selection Committee for the opportunity to present our data.